Chapter 25, we're going to talk about suicide and non-suicidal self-injuries. One of the things that we know about is that suicide is that intentional act of killing oneself by any means possible that they can find. Suicide intent and behaviors are symptoms that are usually manifested in association with some type of mood disorder or a psychological disorder as well. Many people have suicidal ideations, maybe from some sort of pain within. They feel hopeless or helpless about a situation. We're also going to see that patients with alcohol or substance abuse disorders also have a higher risk for suicides. People who usually survive serious suicide attempts often report that they have these feelings that fuel the sense of isolation and despair. And lots of times what they want to do is shut out a thought, or the heart aches, and so they want to leave something behind. It's kind of like as if you, slam your finger in a drawer and you pull it out very quick. You want that immediate pain to stop, and that is what they're trying to do in their minds. Unfortunately, what we find is that suicide is the 10th leading cause of death. It's also the 4th leading cause of death among children ages 10 to 14 years of age. It's the 3rd leading cause of death in those 15 to 24 years. 4th leading cause of death for those 25 to 44, and the 8th leading cause of death of those who are 45 to 64 years of age. Here you'll find a link that I have that talks about some myths and facts about suicide. Listed here are some different risk factors that individuals will have who try to commit suicide or who actually go through with the act. Again, they have an ideation about the act itself. They usually will have a lethal suicide plan. So that's why we usually ask them immediately, do you have a plan? And they'll tell you yes or no. It's very impulsive a lot of times. It's just a way to end something, such as I was saying about the hand being shut in the drawer, and you want to pull your finger out immediately to stop the pain. They do have low frustration tolerance. We do see also that with those who have some type of sexual orientation issues, feelings of guilt and hopelessness. Those who usually do have access to some type of firearm or other type of lethal means. Also to those who have a lack of social support, history of abuse, especially in childhood, and especially those who have had a history of an attempt before. The biological factors we'll see is that there is a central emotional factor, which is that hopelessness. And if you remember back to our neurotransmitters, that serotonin levels are low, which relates to a depressed mood. So any kind of medications, you want to increase that serotonin. You want to, like a serotonin reuptake type of medication. And we find that these also that suicide behaviors tend to run in families. Usually if a child who's had a parent who has actually had suicide, then the child may also do the same thing. When it comes to cultural factors, we have those protective factors, such as the African Americans. It plays a very strong role in religion and the role of the extended family. It's either seen as a shameful thing for these families, especially in the Hispanic Americans, because of the Roman Catholic religion and the importance of the extended family, and it's seen as a disgrace. In the Asian Americans, there's an adherence to religion that tends to emphasize the interdependence between the individual and society. So it can be a very strong feelings for the family, much less the person who is committing or has attempted to commit suicide. Religion is really associated with decreased rates of suicides because of maybe Protestants and Jews have a higher rate of suicide than those of the Roman Catholic Church, and that's because of how the Roman Catholic Church sees that act, and that it's an act against God and the Church. We also see that in the Asian Americans, there is more of a suicide rate in the older population, and that's because the independence and having to depend on the family, and so but then again, there's a high value given to the reputation of the family. So within again, we do see those being reduced because of the shame towards the family, and the belief in reincarnation may make death a potentially honorable thing, such as the kamikaze pilots. That was very noble thing to do, to die for your country. And so again, we'll see the differences in cultures and how they see this. Some in the Middle East see it some martyrdom to be a suicide bomber. And so you have to look at the different cultures and how it impacts them. So looking at the nursing process, we look at verbal and nonverbal cues. And so sometimes people will make overt statements and covert statements. We also want to find out about do they have a lethal suicide plan? Do they have a high-risk method or a low-risk method? And this indicates how quickly a person can die by that method. I mean, someone who has a gun to their head or to the carotid artery has a much better plan than someone who says, I'm going to starve myself. There is an assessment tool that we use. It's called the Sad Person Scale, and it looks at the suicide risk potentials. We also have the safety risk that gives the provider information to help to develop a plan of care to keep this patient safe. On the next slide, you'll see an example of the major risk factors that are associated with suicide risk potentials. Here you'll see the scale. It's a quick assessment of the risk factors to determine the need for further evaluation. It does not address whether they are taking illicit drugs or not, which can also play a significant role. So that is not on that scale. These next few slides are just examples of the SAD person's assessment, and so I just kind of want you to look at that and what each of those mean. Here's the second part, and this is the last part, and how to score. The next portion is the diagnosis and the outcomes and your implementation. And there's some tables listed here for you to look at. There are 3 different levels of interventions that are going to be used, and we'll talk about those in class, and they're in your textbook. The goal is to improve the overall community mental health, to reduce the incidence of suicide most effectively. In general interventions, we often see patients self-treat with drugs or alcohol to reduce emotional pain, and this can lead to irrational thoughts, low frustration tolerance, and impulsivity. These patients may need close monitoring for direct harm towards themselves and also towards others. These are the primary, secondary, and tertiary levels of intervention. Primary, these are activities that provide support, information, education to prevent the act of suicide, so education and making people aware. Secondary is the treatment of the actual crisis, the suicidal crisis. And then tertiary are the interventions with a group or a circle of survivors left by individuals who completed suicide to reduce the traumatic after effects on the family, the friends, and all their loved ones. Your interventions are going to include all these bullets here, and as a team we need to collaborate, work together and collaborate and communicate towards the patient's safety. This can also be done through coordination of care. Documentation is going to be more towards affect and behavior than what they are doing activity-wise. We're going to also do constant reassessment of risk factors, and suicide risk is the highest the first few days of admission and during the change of shift rotations. Another topic is the non-suicidal self-injury, also known as parasuicide. These people might have frustration and confusion, or feeling helpless or hopeless due to sexuality, depression, anxiety, substance abuse. There's a really good YouTube video talking about different celebrities who actually hurt themselves or injure themselves, and some facts about that you might want to watch. Lastly, it is very prevalent. We do see this a lot in teenage girls. We also see the copycats, those saying, well, they do this and this is why they do it, well, I'm going to do it too, or this is what all the girls are now doing. And again, sometimes it's just frustration, confusion, loneliness, helplessness. So a lot of factors can come into play. And there's another YouTube video I have here, and it's Demi Lovato on a 2020 interview as to why she hurt herself and when it started. So very, very informational videos for you to watch.